Hello parents, hello everyone, good evening. This is Dr. Lalit Mittal from Giggles Clinic and my own space. So welcome to this interactive session of question and answers on neurodevelopmental pediatrics. And neurodevelopmental disorders. We'll try to cover the questions, answers of the queries as much as possible within this 1 hour. And And the questions, the parents, all those viewers who are having any queries, they can write the questions on the right hand side on the column. And there is then you can type those queries and I'll be replying one by one by reading those queries. And we'll try to cover as much as possible. We'll be closing up the session sharp at 9 o'clock. And if the queries are left or some of the parents, those queries are left, we can take in over in the next session. Am I audible? Hello, am I audible? So we can begin with the queries. This is a totally question and answer session. So parents can start with their queries and then accordingly we'll proceed further. Hi. Yeah, so hi. So the first query is, hi sir, could you please, what's dyspraxia? How is it different from fine motor issues? And how to identify at home and what are the remedy? See, dyspraxia is basically, it's a learning disorder, or what we call it comes under basically a learning disorder. And there are various types like dyscalculia, dyspraxia, or you can say dysgraphia, dyscalculia. All these are basically clubbed together in learning disability. Now, learning disability is also a part of autism. It's not that we can separate this learning disability from the child who is having autism. This is a part of the spectrum. So dyspraxia basically means that there is a difficulty in motor planning. Motor planning in sense, there is a difficulty in carrying out the motor activities, which can be either in the form of, writing, which can be either in the form of gross motor activities, which can be in the form of fine motor activities. So this is the thing where we have to work on these motor skills. Either it can be in the form of fine motor or it can be in the form of gross motor. So how to differentiate it? Fine motor issues. See, dyspraxia includes both the parameters. It can be a fine motor, it can be a gross motor. So depending upon the severity of dyspraxia, whether the child is having gross motor issues or he's having fine motor issues, then accordingly we have to look into doing the examination of the motor skills. Now, motor skills examination basically includes two types: fine motor skills, gross motor. Fine motor, when we have to check for the pincer grasp, if the child is able to hold the pencil in the web, if he is able to collect the pebbles with the thumb and the index finger, if he is able to grasp the things properly, if he is able to hold the glass, if he is able to hold the pencil, if he is able to hold the umbrella. So these are all the fine motor skills, which tells you about the fine motor activities. And then if you go in terms of gross motor, say gross motor, jumping, walking, is there is a balance issue, is the child is able to walk properly, or is there is a jumping issues. So or you can say cycling, footballing. So these are gross motor issues. Hopping. So these are the gross motor issues. So we have to do a thorough examination of the gross motor and fine motor, and then accordingly we have to judge whether it is which form, whether it is a fine, whether it is a mild, moderate, or severe. So accordingly we can judge. Now, what is the remedy and how to identify at home and what's the remedy? See, there is, as said, there is no hard and fast rule that, okay, we'll do this, the remedy will be done. Basically, what happens, you have to look into the, suppose if it is you have to get in touch either with the OT or get in touch with the physical therapist or the play therapist. They can guide you accordingly. Suppose if it is a gross motor involvement. So accordingly, you have to work on the muscles, core strengthening muscle, the core strength muscles, like you have to do hopping or jumping, or what are the basic exercises they can teach you in empowering your, increasing your gross motor, increasing your strength of the gross motors. So this is how you can work on this. And if it is on the basis of fine motor, like the holding, pencil grasping, or writing skills, then you have to work on the tabletop. That means tabletop means where your occupational therapist can work on these, and accordingly you can proceed with these things. As such, in medical point of, if you talk in terms of therapy in medicines, no such thing is there which we can work on this. The therapy is the main thing which we can work on them. So hi, in mild autism, what can we do for speech to overcome? See, in mild autism, what we can do to speech to overcome, it depends. See, to speech to overcome, basically you have to work with the speech therapy. This is the main, this is the golden rule, that definitely you have to work with the speech therapist. And then depending upon the severity of the speech therapy, or what type of speech disorder the child is having, whether it is having an articulation disorder, whether he is having a phonological disorder, whether he is having apraxia. So it depends upon the severity. Now, in mild autism, it doesn't mean the child will be having a speech of mild, moderate, or severe, because the definition of autism, which we characterize by mild, moderate, and severe, we do not include much of the speech. We include more of the, you can say, his sensory issues, his more of his repetitive features, and what about his communication. So, speech might be speech. The child might be having a good speech, but his communication may not be that much good. In the sense, means to say, he knows the speech, he has the vocabulary, but he doesn't know where the speech has to be given, in which particular environment, in which particular content related to that person. Means the language is delayed, or the language is affected. So accordingly, we have to work on them. But definitely you have to get in touch with the speech therapist, because if it is an articulation issue, or if it is a phonological issue, then they have to provide corrective therapies accordingly to that. And if it is on the basis of, apraxia, or if it is a non-verbal issue, then you have to do therapy according to that. So the speech therapist will guide you, along with the OPT, that is oral placement therapist. They can guide you accordingly. We can work on that. But there are no medication which can directly act on the speech therapist centers. So another is, how can you know whether your child has mild or severe autism? How to judge it? See, mild, moderate, and severe. This is the classification. This is a clinical classification. How we can judge? So there are basic standardized tests are there. In India, we use ISA, that is Indian Scale of Childhood Autism. Then Indian Scale of Autism. Then we have another scale which is CARS, that is Child Autistic Rating Scale. Another one is there which we call as ADOS, and one more is there, that is ADI, Autism Direct Interview Revised. So these are the basic 4 skills which we are using. In my practice, I'm using ISA and CARS. So on the basis of CARS, we can divide the child on the basis of this. There is a score is there, that is less than 30, 32, 34, 35, and above. So depending upon the score which we get, there is a total items of 15 which take into characterization of various parameters: sensory, behavioral, language, speech, his body language. So all these parameters include, there's a total set of 15. Then accordingly, we characterize the child as mild, moderate, or severe. So depending upon how to judge it, how to judge it, you cannot judge it by simply saying whether the child is in the mild. Or see, we can definitely tell that he's a high functioning or it is a low functioning. In high functioning, generally what happens, the child will not be having too much stereotypic behavior, although they may be having an eye contact issues, that is social issues will be there. Whether it is a mild, moderate, or severe, the important thing clinically to judge a child who is having lot of stereotypic behavior, or you can say aggressive behaviors or self-injurious behaviors like head banging, aggression, biting. They generally come in the category of moderate to severe. Whereas those which are high functioning, they will have mainly issues of social communication. That is, they will have socialization issues, how to greet with other person, how to say hi, how to respond, how to initiate the command, or even if they are able to initiate the command, how to continue with the conversation. So these are the issues. Communication issues will always be there in mild, moderate, and severe. But stereotypic behaviors, or what we call as stimming, it is an aggressive behaviors. which is basically a consequence of excessive stimming, is more common in moderate to severe. So my daughter put anything in mouth and lick. So there's another question is there. My daughter put anything in the mouth and lick. See, what does that mean? My daughter put anything. See, it depends. It depends. Simply by judging into this question, judging by this statement, we have to look at what may be the cause why the child. It can be an oromotor issues because they have lot of it depends. Either it depends whether they are sensory seeking or they are sensory avoiding, or it can be undersensitive or it can be hypersensitive. So depending upon these issues, we have to judge that whether what are these parameters, why he's seeking. Other issue, if you go in terms of medical point of view, they can be deficiency of iron, what we call as pica. Pica means the child are taking more or less most of the times non-edible things. So we have to rule out iron deficiency. Other things we have to rule out oromotor sensory issues. Oromotor sensory issues where the child is taking most of the things in the mouth, and why they take, they may be having sensory issues. They may be having gustatory issues. Gustatory means they don't want to taste the thing. Smell, olfactory, they don't want to smell the thing. Or they may like most of the time they may be having crunchy food, to take the food more crunchy in the mouth rather than taking soft food, because they may be hypersensitive, they may be undersensitive, so they want to take more food so that they can get that sensory input into their mouth. So these are the things which we have to look for. Can autism be reversed with age? Can autistic people lead a normal living? See, first of all, autism, the definition of autism, they say it is a neurodevelopmental disorder. But now it's a hard time that we should basically change this definition of it's a neurodevelopmental disorder. It is not a neurodevelopmental disorder. Rather, I would say it is a diversity of the brain, neurodiversity of the brain. See, there are plenty of tests which have been available for any number of diseases. But for autism, as such, there is no test available which you can confirm yes the child is having autism, the blood test. So, and we cannot say this child will be able to lead a normal life or he's not be able to lead a normal life. The only thing is that the perception, the way they look the world, the way they perceive the world is different. See, I'll give you a very simple example. We know that suppose take an example, current flows from circuit A, B, C. So what happens in an autistic children, or we can say that in a neurotypical child, the information flows from circuit A, B, C. Whereas in autistic children or in our kids, the information may be flowing from circuit A, then C to B. So that means there is a mismatch of information, or the current or the circuit which is there is mismatched. So what we can do, we have to, there is no medication, there is no therapy which can correct it. We have to do repetitive commands. We have to give repetitive judgment. We have to do repetitive commands so that what happens, the alternative circuit which has been created in autistic children, it gets slowly and slowly weaken off, and the right path which is there to flow the information of the current, that keeps on building up. How it can be done? By giving repetitive commands in the form of therapies, what we are doing, the sensory part which we are doing, so that the sensory input, the motor input which goes into the brain goes from the right track in the right therapy. So that is why it is very, very important. Plenty of people, lot of people are going for therapies, lot of people are working hard with their children at home. But the important thing is that are we doing the therapies, are we going in the right direction? Because the therapy, the rationale and the direction of doing the therapies or medications or biomedical or whatever speech therapies we are doing, they should be in the right direction, in taking into consideration the abilities of the child. This is very, very important, because there is a very good saying, and if you must have heard, if you met with one child with autism, we meet with one child with autism. It means to say that no two child on the spectrum will have the same issues. One child might be in a spectrum from 5%, other child may be on the spectrum of 95%. So this is the diversity of autism. So we cannot label the therapy that this is the standard protocol for each and every child. One child may be benefiting from ABA. Another child may be he may be worsening from the ABA therapy because of the use of continuous reinforcers. Guide the therapist or the doctors or the professionals how to approach the child. So this is the thing. So autism cannot be reversed. So the crux is autism cannot be reversed, but definitely with time, children do get adapt with themselves, how to cope up with the environment, how to cope up with their abilities. So it's not that it can be reversed, but yes, they can come as close as possible to the neurotypical kids depending upon the individual ability. Some may require assistance of the parents or caregivers even in the adult life, and some of them may not require assistance even in their adult life. They can carry out their routine activities. Do you have any suggestions to stop head banging, which is more because of behavioral issue and attention seeking behavior? See, uh, whatever form of behavior the child is having, whether it is head banging, whether it is biting, all any type of behavior which is there in the child, it always lies in the four categories. First is attention seeking. It can be medical issues. It can be tangible. It can be sensory, or we can say over volume overload or attention seeking factor. So if we feel the child is having, as one of the parent has said, that the attention seeking. So one of the most important thing to look for to correct the attention seeking behavior is that you have to avoid giving attention. And how you can avoid giving attention? Ignore. Don't give eye contact at all. Suppose I give you a simple example. Suppose you have tell the child not to write on the wall with a sketch pen. Now he will continue writing. Again, you will tell not to write. He will again continue writing. So what is this happening? The child, you are telling don't write, but the child is writing. So what is happening? The child is performing an action on the wall. You are giving him a reaction not to write. Now this reaction is giving him a reinforcement that yes, some reaction is there. The parent is getting the parent is giving me an attention if I write on the blackboard, if I write on the wall. Because if I'm writing, he is giving his reaction, whatever the reaction you are giving, whether you are looking him in angry form, whether you are telling him I'll give you a slap, whether you are telling not to write, whether you are yelling, but in one or the other way you are giving him a reaction. So that gives him an attention that yes, the father or the parent is giving me attention. So in that case, best thing, ignore the situation, walk away from that situation, don't give him an eye contact. This is the best way to approach for an attention seeking behavior. And there are other forms, but specifically they have asked for attention seeking. So we have to look for, so I've given a idea how to go for an attention seeking behavior. Now head banging. Head banging can be an attention seeking. If it is attention seeking, we have to follow these rules: avoid eye contact, ignore the situation, walk away. If it is in head banging, if it is not due to attention seeking, then you have to look into the cause, whether the child has communication issues, he is not able to express it, whether he is having stimming or the sensory issues, that is, he is so much overloaded with the information. Either it may be at home, either it may be an outside, it may be a cinema hall, or it may be a market, or it may be a relative's place. It depends. Or it may be a school. The child may not be comfortable, he may not be express his needing. So that form of fear, anxiety might be coming out in the form of behavior, that is head banging. So in that case, if it is not due to attention seeking, we have to look into these causes in detail, and accordingly we have to take appropriate action what we can do. And we have now how to stop nail biting. See, nail biting is another, it depends how this nail biting is there, whether nail biting can be due to iron deficiencies. See, nail biting is a very it can be due to worm infestations. It depends. But if you talk in terms of behavioral issues, nail biting is could be, it could be a tactile issue. It could be a sensory issue, or it can be a sensory. So in that case, what you have to do, there is a one word which we call as replacement behaviors. See, the child is having, why he's doing nail biting, he may be doing a nail biting in a particular, it depends. First, we have to look into the cause. Is the nail biting generalized? Is it occurring in a particular environment? Is it occurring with a particular person? Or is it occurring everywhere? Suppose suppose the nail biting might be occurring only in the school. When the child is in the school, the teacher may be complaining the child is doing a lot of nail biting, and the mother says, "Ma'am, it doesn't do at home at all." But the parent, but the teacher is complaining, he always do it in the class. So in that case, the reason may be the child may be having anxiety. He may not be comfortable in the environment. He may be feeling alone. He may not be that in a natural environment as he feels comfortable in the home with the mother. So we have to look into all these causes. It can be due to anxiety. It can be due to fear. It can be due to communication issues. It can be due to sensory. So in that case, what we have to do, we have to give the replacement behavior. Now, replacement behavior is a technique where we replace the difficult behavior or the challenging behavior with an alternative behavior. What we can do, for example, if a child is doing nail biting, so it could be a cause that the child is having oral sensory issues. He wants more hard, he requires more hard crunchy food in the mouth because he's hypersensitive. So his oral issues will be resolved by taking a more crunchy or hard food. So in that case, what you can do, you can replace it with a carrot or hard thing. You can give him some hard products. You can give him like carrot or any other things you can give. Suppose if the child is doing the child is hitting or punching the other colleagues or the peers. In that case, what you can do, you can replace it with with a sandbag, because here the child is having is having an extra sensory input in his hand, or you can say the fingers. So in that case, what we can say, we can replace it with another hard thing, for example a sandbag. So these are the replacement behaviors. But these replacement behaviors, again, it depends. First, we always have to look into the cause. What is the cause of that behavior? Because unless and until we are not able to look into the cause of the behavior and just generally jumping onto the statement, it's very difficult to analyze. We have to think from the child point of view rather than from our point of view, that why the child is not listening. See, how to improve social interaction in ASD kids when they are trying to avoid and moving out from place moving out from place when people are talking. See, to improve social interaction. See, social interaction is one of the biggest challenges for every parent. And there was a video which I released regarding the social interaction: eye contact, imitation, and joint attention. These are the three most fundamental things we have to work on to improve the social interaction. See, um, a 10-year-old child, he will be able to express each and everything. He will tell you the details of the history. He will mug up. He will be in the rote memory. He will tell you everything. But how to show etiquettes in a dining room, how to show etiquettes in a restaurant, how to greet with others, he will be lacking, and the parents will be struggling. The reason why? Because we are not working on the eye contact, we are not working on imitation skills, we are not working on joint attention. So the best thing what we can do for socialization, give them lot of social stories to learn. Give them make an habit of going for social stories or any storytelling during the night time. So because why, what happens through social stories, they will be able to learn, they will able to self adapt themselves, they will have self awareness. Self awareness means to say they'll be able to regulate their emotions. Unless and until they are not able to regulate the emotions, they will not able to understand the emotions of others, what that we call as social awareness. So social awareness is understanding the emotions of other. Self awareness in understanding the emotions of us. Unless and until we are not able to provide them with these social and self-awareness, we will not be able to develop socialization. Another thing is that video modeling. See, there is we must be I think every parent must be knowing that autistic children, they are strong visual learners. That is why we always provide them with behavior charts. Whenever we provide them with the rules, we provide them with behavior charts. See, when you are angry, though, your face should be like this. You don't have to bang, you don't have to hit, you don't have to shout. Make a face, I'm angry. Or if you are smile, make a smiley. Or if you are upset, you give a smiley of upset. So these are the behavioral charts which we provide. Why is that we provide them with behavioral chart? Because they have a difficulty in reading the abstract language, or they have a difficulty in reading the context. So that is why it is very, very important that you provide them with video modeling. Because whatever you will provide them, suppose what we can do, suppose you want to go to some relatives house, you know that where we have to go, nani ko namaste karna hai ya unke pair chune hai. So you can prepare your child well in advance, suppose a day before, or the 3 to 4 hours before, through video modeling. So this is a way which we can do. Or if you have other child in the home or the siblings, you can provide the modeling through that, through the peers, because the child will learn very, very fast through the peers compared to the adults. So these are the basic ways how we can improve socialization. For eye contact, never, whenever you are giving a command to the child, never give a command unless and until child is not taking eye contact. And how you can take, see, you can keep your hand like this. This is what we call as a tunnel vision. Cut off his temporal vision so that he cannot look in there. if it is possible, if he's not, hold his face, hold his head and give a command. When as soon as he gives you an eye contact, give him the command. And remember, whenever you give an instruction, it has to be only once. It should not be repeated again and again. There is a term which we known as discrete trial sequence, or DTT, discrete trial training. It is an technique to give an instruction and to improve eye contact. Suppose I tell a child, give me a glass of water, and he's not having any contact. He's looking here and there, up and down. Again, Nishan, look here, give me a glass of water. Nishan, get me a glass of water. Nishan, get me a glass of water. I'm telling him so many times, he's not looking. This is so what we have to, what is the right approach? Just tell him, Nishant, look here. If it is not looking, wait for that moment when he looks. If he's not looking, again tell him, look, or hold his face. When he gives you eye contact, just give him one instruction, get me a glass of water. You don't have to repeat it. Now, if he's going there, he will be going there. Of course, give him a prompt. Give him a prompt so that if he's not able to, if he went into the kitchen, he doesn't know what is the glass, if he's picking some other utensil, give him a prompt by pointing, so that when he takes up that glass, provide him with a reward or a positive reinforcement. Need not be in the form of material. You can give applause, you can kiss him, you can hug him. So these are the basic ways how we can develop the eye contact, how can work with the child. There are no hard and fast rules. We just have to work with the child for these things, involve them in household chores as much as possible. See, therapies where we are going, and this is the right time for our parents to work with the child on the socialization issues, because there is a lot of thing what happens कि ये 90% पेरेंट्स की कंप्लेन होती है कि थेरेपी सेंटर में वो सब कुछ कर लेता है, घर पे नहीं करता. क्यों? Because they have not developed the concept of generalization. Working things in the therapy center means specific. They have a specific person there, they have a specific time there, they know this is the person, so they are tuned to that routine. But when the parents try to do that same thing at the home, they don't do, because the routine is set, the environment is changed, the therapists are changed, so everything is changed. So our mode is that what they do at the therapy, if they are able to do that same things at home, probably our therapies will be cut by more than 50%, and the child will able to learn that concept of generalization. That is why provide the nutrition at the home as much as possible, nourishment as much as possible at the home, but the supplementation or the advice you can take from the therapy. But the main nutrition, the core nutrition, has to be done at the home. Now, another question is there. Can the primitive reflexes be integrated or excess neurons be pruned naturally with the age? See, yes, definitely. What happens? We say as the child grows, we all know that a neurotypical child and autistic child, they will always have a difference of, say, depending upon the severity, but minimum they will have a difference of, say, 1 to 2.5 years. And what happens? We generally don't give time to the child. As the child advances with age, definitely his development skills will improve. Although he may not be age appropriate compared to the neurotypical child, but definitely his skills will definitely improve over a period of time. But if you say naturally, will the primitive reflexes be integrated? No, they don't get integrated completely, but to some extent, yes. Plus, working with the therapies, working with other nutritional support, working with the professionals, working with your guidance, working with the therapist, these primitive reflexes can be integrated to even a more extent. But naturally, these excess neurons cannot be pruned naturally with age. We have to work on them. And in fact, if we leave the child, if we don't introduce the child or subject to them into early intervention, after 6 years, the chances are very, very less, because early intervention concept is up to the age of 5 years. And we know that by the age of 5 years, a child brain is equal to the brain of a 40-year-old child. So we can imagine that working on the child after the 6 years is very, very difficult. So whatever efforts, whatever ways we can provide the efforts to the child, it has to be within this critical period of first 5 to 6 years. Is the brain development slow after the age of 12 years in ASD? See, I have told, there is nothing like that in a child with ASD, but in fact, if you have gone through my topic on neuroanatomy of the brain in ASD, what happens? There is an excess growth of the brain takes place. There is a trajectory. What happens in a neurotypical child, the growth of the brain is like this, where in the first 5 years, whereas a neurotypical child, the growth of the brain like this, and then it comes down. So what happens, why it grows? Because due to the presence of excess amount of information, excess amount of neurons which are there, and then it suddenly goes down. Why? Because that pruning process, the process what we call the excess neurons, which has to be they have to be get integrated with other neurons to carry out a functional and more concise and complex commands, that doesn't happen in the autistic children. By the age of 5 to 6 years, this pruning should happen, but it continues over a period of adults, and gradually the pruning might happen. That is why we say that, but the majority of the pruning jo hoti hai, it takes within the first 5 to 6 years. But why we say then that child by the adult, it may gradually and gradually may adapt to the environment. Why? Because this process of pruning keeps on going even in the adult life. But that severity, that pruning process depends from child to child, depends from adult to adult, and depending upon how much pruning it has gone, accordingly the results of adaptability of the child into the adult life will vary. Is cognicare fish oil good for autistic kids? See, these are some of the questions which we cannot answer directly. That yes, this is the golden or the standard rule, and it is good for every children. See, definitely uh, omega fish oil, or we can say omega 3. It is very good for the development of the brain. It helps in improving because of the increase, because of the DHA and EPA. They are very good for the brain functioning. They are good for the neurons. But it all depends from the severity and also from the functioning of the child, how severe, how moderate it is. But all these things, they have, we have to work together. And uh, if we go by the literature, omega 3 do help, but there are a lot of literature which says omega 3 might not be that efficient. But in some literature they say omega 3 might be efficient. But one thing is sure, that autistic kids do have natural deficiency of omega 3, which is required for the normal functioning and the growth of the neurons. So in my opinion, yes, omega 3 will definitely help in the autistic children, but provided not as an isolation therapy, as a combination therapy along with the OTs, along with the speech, along with the sensories, along with the OPT, along with the natural therapies, and along with the most important efforts of all our parents, family members, and caregivers. So no therapy in autism work in isolation. You have to work from all the four corners of the room. Then only we'll provide an effective therapy. And at the end, we would not be actually knowing whether this improvement has been due to this therapy or this therapy. But we have to work together on from all the corners. Now, Cognicare is basically an amino acid which basically helps in removing the excess, what do you say, oxidation stress. Now we know that in autistic children they have defects in the cellular level. They have a lot of oxidation stress. They have a lot of methylation issues. They have a lot of stress levels in the body. As a result of you, there is one term which we known as redox potential. And if you know that in autistic kids, the ratio of this redox potential decreases. Means to say, there is one term which is known as oxidized glutathione and reduced glutathione. So this oxidized glutathione increases in our body, means to say the oxidized stress level, the stress levels in our body increases. And this basically happens because of these B12 deficiencies and vitamin B6 deficiencies. Not in all, but in majority. So as a result of what happens, this Cognicare is an amino acid which may help in working out these problems. Now, there is a Cognicare, and another which Cognicare comes by another medication is there in the same group, which we call as L-carnitine, which is known as L-carnitine, which is Carnissure. Now, Carnissure and this Cognicare, these are the two different medications. And recently, I have given a lecture on webinar on biomedical treatment, and where we have compared the relation versus Cognicare versus Carnissure. And in my practice, I am giving Carnissure or L-carnitine more than Cognicare, because it has been proved to be much beneficial compared to Cognicare, and long-term effects compared to Cognicare are better. So omega is useful for autistic is definitely, as I've told you, they have deficiencies. It helps in improving the neuronal functioning. function, it may help you improving the functioning of the brain. But how can we increase the memory power? See, memory power, how we can increase, you have to work on the word memory, you have to work on the vocabulary, you have to work on the memories. And for these things, it will be a more better way that your OT will give you a better answer how you can improve the memory power of the child with the particular techniques. How to help 4.5-year child to put wrist down while coloring? He still scribbles out of the border, try to give thick border, but didn't work. He can write white, okay. See, this is again an example. This is again an example where the child is having deficits in, fine motor skills. And another thing where the child is having the problem here is proprioceptive. So when we have to write with the pencil, when we have to hold this grip and the pencil, when we at the pressure through which we have to write, that defines how beautiful the writing will be and how controlled the writing will be. So in order to write a correct within the borders with a controlled hand, you should have a proper pressure on the pencil. So what we call as proprioception. So in that case, you have to work on the proprioceptive issues, discuss with your OT how to work on these proprioceptive issues. He may provide you with the tabletop therapies, he may provide you with the circle therapies, he will provide you with the circle of fate. So these are the various examples I have told you. You can get in discuss with your OT and work on the proprioceptive issues. The child here is having a proprioceptive issues. So accordingly, you can discuss with the OT and you can find techniques which he can tell you to work at home. So any suggestion to improve imitation skills? See, imitation skills, I have told you the most important thing, you have to go for video modeling. Video modeling is most important. Then you have to go for peers modeling. If there is any other person who is there, then demonstrate. You work on them, demonstrate how we have to do, involve them in the household chores, the natural things. See, imitation is not that thing which you will come out naturally. Suppose even a 6-month child has his imitation, but our kids might not have imitation. It might come at the age of 3 years, it might come at the age of 4 years. So naturally, natural kids, we don't have to teach them, they just observe them, they just look at the things and do it accordingly. So why our kids don't do it? First most important thing is that they have a poor eye contact. Unless and until child will not look into our eyes, he will not look at us, that how the person is doing, how the person is speaking, or how the person performing the same activity, his imitation skills will not develop. So for the imitation to develop, the most important thing is that eye contact. The most important thing is engagement. The child should have a good eye contact, he should have a good level of engagement. And how you can develop it? Involve in a lot of household activities, involve him in instructional activities, by giving him repetitive commands of giving in eye contact. Or there are some uh, techniques are there how you can improve the eye contact. You can follow the torchlight or you can follow the pencil light. Tell them to look at these are the exercises up, the child will follow the eyes. Or you can, with the help of a torchlight, you can generally follow, the child will follow. But generally these experiments, what happens if you do these exercises, child will generally able to follow. Why? Because they are very fond of these flashing lights. If you provide them, they will definitely follow. But if you provide them with any activity, then it will be difficult for them. So the best thing is provide them with video modeling or the modeling. Whatever you do, the child has to perform that. Involve them in the natural course, household course as much as possible. And whenever you give them an instructional command, always take the eye contact, set them at the level. Never give him a command if the child by standing. You should always, your eye contact should be at the level of the child whenever you are giving a command. Then only the child will able to look at you. Don't basically think that the child will look up at you and he will follow. No child will follow that. You have to give them the command at their level. So sit on your knees, give them the eye contact. If it is possible, focus the eyes, cut the temporal vision, look the tunnel vision, and give them the command. This is the only way where we'll follow. And naturally by your efforts, one day the improvement will be there. But it is not a quick fix method, it is a slowly and gradual method. My son is 3-year-old having a vocabulary of 300 words. So is under speech delayed category. And can we introduce mother tongue and English simultaneously to kids? They will get more confused. Yes, this is a very genuine problem that in autistic kids, if you are following the two languages, it is very, very tough for the child to grasp. And in my opinion, I would suggest that you follow one of the languages. Either you can follow the mother tongue or you can follow the English. It depends in which language you are comfortable with the child and which language child is taking more. Gradually, over a period of time, when he's comfortable with one language, when his vocabulary is developed, when his vocabulary is that much strong, then you can introduce the second language. But don't worry that he will not be able to understand English if you are following the mother tongue, or if you are following the English, he won't be able to understand the mother tongue. That is not the concern right now. Our concern is to improve his vocabulary, improve his speech. So in my opinion, you should follow only one language. I mean, one whatever language you are following, mother tongue or the English. So what is the role of stem cell therapy for autism? My dear friend, there is no role of stem cell therapy, and stem cell therapy is totally obsolete. And I have discussed this in my there was a webinar recently which I meant evidence-based practices and evidence-based interventions, or you can say evidence-based biomedical interventions in autism. So that webinar was totally on evidence-based. What is the research? What is the Cochrane review? And what is the latest literature which says stem cell therapy, chelation therapy, to mention stem cell therapy, chelation therapy, and even hyperbaric oxygen therapy, they are totally obsolete. They are not recommended at all. In fact, rather than giving any beneficial effect, they will give more harm to the child. So it's my sincere opinion, sincere advice to every parent, every caregiver, that kindly don't go for these hyperbaric oxygen therapies, stem cell therapies, and chelation therapies. And we have discussed a lot about chelation therapy, and a lot of people are going for DMSA therapies. They are not at all recommended. In my webinar, we have also discussed about metal analysis, hair metal analysis, why it is giving a false value of the toxic levels of various heavy metals in the blood. So if those parents who are interested, or those who have listened, that is fine. And those parents who are interested to know more about that, they can just drop us an email at gigglesclinics@gmail.com. We can provide you with a webinar link. So there is no role of stem cell therapy. Which sports will help ADHD kids to increase attention? See, I think this answer would be replied by Ms. Rohini. She is a special educator. She is basically an MPhil in special sports, and she is also a part of our, in our panel. And there was a webinar which was given by Ms. Rohini ma'am, sports beyond benefits of sports in autism, and what are the various sports which we can improve attention. See, broadly, I can tell you, swimming we know, and skating we know that they are the very good sports which can help in improving attention. But other sports which we can do, skating is there, cycling is there, other things you can go on. Those things which we have to work on the we have to concentrate on the attention. So other things which we can do, like hitting, hitting on a particular point, or you have circles are there, targeting, or you can say targeting with a particular point with a gun on the point. So these are the basic things. But again, Ms. Rohini will be better to give you an exact which particular sports which can help in improving the attention and decreasing the concentration of the child. Which activities can be helpful to reduce hyperactivity? See, hyperactivity at home can be reduced by performing pull-ups. You just have to make, the thing is that what happens when you want to reduce the hyperactivity of the child, you basically want to channelize energy in the right direction. So it depends upon how hyperactive is the child, and also it depends upon what are previous therapies or the exercises you are doing with the child. So just to begin with and give you a gross, you can do wheelbarrow, and you can do beer walk, you can do frog jumps, and you can do, it depends upon, you can do what you can say, trampoline jumps. So, and also you can do push-ups, you can do pull-ups. So these are the various activities which will help in reducing the hyperactivity. Now regarding trampoline, they are basically two school of thoughts. It depends from child to child. Some of the parents, they have experienced that through trampoline the hyperactivity increases, and some of the parents experience that through trampoline the hyperactivity reduces. So it basically depends from child to child. So broadly, if I have to tell you what all the activities, these are the activities which I have mentioned. But again, you have to look which activity suits to your child. If a child run away from the activities, how to handle? See, again, if a child run away from the activities, see, what we are doing, we are more focusing on the problem with the child. We are more focusing how to resolve that problem, that if a child run away from the activities, how to handle. We are not looking into the cause that why the child is running. So the approach has to be retrospective rather than into be a direct. We don't have to directly jump into reason that why the child is running, we have to stop him. Our approach is the child is running, we have to stop him. So what we can do? No, we have to go other way around. You have to think in terms of the child. Just imagine yourself in place of child and then think why you are running. Now it could be a reason because he is not able to understand the thing what is happening there. He is so much over bombarded from the information from that particular place that he just want to run away. So that means he's cutting the environment, he's cutting himself from the environment. So what we call as sensory overload has been there, so he want to cut off the environment. Or he's not able to understand what the person is telling, or he's very annoyed with some person. So first we have to look, don't have to be judgmental so fast. We have to be first look why the child is doing so, and then you have to look into the cause, that if the child is not able to understand that command, you have to repeat the command in a more simplified way so that he's able to work on it. If a child is having sensory issues, then you have to work on those sensory issues. If the child is annoyed or angry with something, you have to work on that. Or if he's running only after seeing you but not with the parents, but not with the other care members of the family, he may be an attention seeking. So these are the things we have to look. The problems or the behavioral problems in autism is such that we cannot rightly jump onto the problem and solve it. We have to basically read and study the history of the child, or the history of the problem, basically not with the child but the history of the problem. Then why it is happening, what is the frequency, what is the duration, and since how long is happening, and is it happening on a particular date, is happening with a particular environment. So these things we have to look into that, and accordingly we have to proceed. Please give some suggestions for impulse control. Example, grabbing chocolate, running out of class. See, again, the same thing which I have told in the previous question. Why the child is running out of the class? Probably he's not comfortable. He is not able to understand what they are telling, or he's having lot of anxiety, and he may not be feeling comfortable. He's not having that safety he's not having that safety environment which he gets at the home. Or is he running in a particular time in the school? Suppose he may be running in the morning only, because in morning time they may be the some one of the teacher comes in which the child is not comfortable. Or he may be running during the recess period. That means now it means that the child cannot take more overload, he needs a break. What happens when an autistic child is in a class of say continuous from say 10 to 12 or 10 to 1? It will be very difficult for them to concentrate for the whole period. you know and so you have to provide them with the recess, you have to provide them the break. Or sometimes what happens, the child may be on a medication, so the effect of the medication might be weaned off by the time the 12 comes. So as a result, the child will be comfortable first 2 hours in the class, then the remaining 2 to 3 hours he may not be comfortable, and he may be started showing running hyperactivity because the effect of the drug has been weaned off. So there are a lot of things, lot of factors which we have to look into consideration, and accordingly we have to take decisions. What is the role of ketogenic diet in autism? There is no role of ketogenic diet in autism, and the role of ketogenic diet is only in epilepsy or refractory epilepsy. But in autism, there is no role. This thing we also discussed. There is no role of ketogenic diet. So please don't go for ketogenic diet in autism. How to stop rumination? Like my child only think about train journey throughout the day. If I divert, then also after some time he start thinking the same. See, in this thing, what you have to do basically, you have to try to divert the mind of the child. You have to try to divert him, try to involve him in some other activities, or there may be a particular, or is there in a particular reason why the child is thinking in that continues about the train journey, or what one thing you can do if the child is thinking about the train journey, try to build up his vocabulary through that. You can ask him so many questions about train. Okay, where are you going, or where we have went, or discuss about some past thing. And alternatively, gradually what you can do, you can start diverting him from, not directly from the train to say some other thing. Discussing from the train, gradually and gradually you get switch over to some other discussion. Suppose, okay, we travel in the train journey, this time we travel from here to there, we traveled from Delhi to Karnataka, from Karnataka we went to Mysore, from Bangalore we went to Mysore, in Mysore we did this, or something like that. It should be started from the train, so that the child gets your level of engagement and the child is also engaged. And then slowly and slowly you switch over the topic above from the train to some other thing, but should be related to that whole journey. So this is how we can gradually and gradually divert the mind. It's not that you have to just tell him, no, no, don't discuss about train, why you are talking always with the train, talk about this thing. So this is the thing we can work on, and then gradually and gradually we can change the direction. See, one thing is very very important in our kids or autistic kids. We have to approach from the child point of view. Suppose if a child is interested in playing with the glasses, steel glasses, he want to bang the glasses. You cannot tell him, okay, stop, we will play with this plastic glasses, ये bang कर रहे हैं, इससे नहीं खेलना, वो possible ही नहीं होगा. So what we can do, we engage with the child in that, in his activity, but in a better and a more constructive way. So if he's banging like this, just tell him, okay, we'll put it like this, we'll do something like this, get it from the back, or some make faces. And so in this way, this will also help the child to engage in your activity, and also he will start may develop imitation. Suppose he's banging like this, you tell him to, you do it like this, you bang it on the opposite way, you bang it up on the opposite way, you make it faces like this, bring the glass from back, some or the other activity, so that the child gets fun, he enjoys it. So if he's getting that engagement level, he will also try to perform that activities, and ultimately we will able to start developing his imitation skills, we'll start developing his eye contact. So these are the various things we have to work on the child, and it should be from the child point of view rather than from our point of view, that no, this thing has to be done through these rules and only through these instructions. It has to be followed through the child and child-centered way. How to stop self-talking? See, self-talking is very common. The most self-talking is very very common. It is basically what we call, either it can be echolalia or it can be due to self-stimming. So this will gradually resolve by working on the sensory diet. Sensory diet means there are a lot of sensory activities are there. Sensory diet doesn't mean a diet, basically a lot of sensory activities which you can work with the child and involve him. Now again, it depends upon self-talking when it happens. If the child is left, generally it happens when the child is not engaged, he's left alone. So you try to involve, you prepare a schedule, or which we call as scheduling. You prepare a scheduling of 24 hours in which you give the child very less time to remain ideal. And generally these things happens, stimming happens when the child is, this is known as vocal stimming. This generally happens when they are left alone for too much period of time. To try to involve them, prepare a schedule so that they are minimum left alone. Engage them as far as possible in constructive activities. See, how to stop pattern forming behavior. See, again, this is a very common problem of many parents, how to stop pattern forming behavior. See, pattern forming behavior, it can be an escape mechanism, it can be an avoidance mechanism. For example, I just give you a simple example. uh, if you are the child, you are you are doing say reading with the child doesn't like reading and he likes painting. With the painting he will be very comfortable, he will be enjoying, he will be listening to you. But suddenly when you switch over the book from painting to reading, he will start banging his head, he will start banging, and it will continue banging until the mother stops it, because he knows, yes, after banging the mother will stop. So this is a pattern that he has developed. This is just, I'm giving an example to explain. he has developed a pattern that if I'll bang the table during the reading class, the mother will stop. Suppose on the first attempt you stop. Now in the second attempt, again you start, the second day you start working with the reading with the child and you start banging. You will again tell no, no, no. But again you close it, he will bang even more. So this is what we call as a pattern. The child has developed this pattern of banging, that whenever the reading class begins, I'll start banging and I will not be able to read this reading chapter because I don't like reading. So this is an escape mechanism or an avoidance because you don't want to carry out this work. So for this pattern behavior, you have to intervene immediately and you have to stick to your commands. It has to, you don't, there should not be ifs and buts, and it should be very, very strong. Unless and until we don't intervene and we don't break this pattern behavior, we will not be able to succeed it. So in pattern behavior, the only advice I would give you that you have to intervene as early as possible and break that pattern, because if we are not able to break that pattern, then day by day it will become more and more rigid and will become more difficult for us. So instead of suppose if he's not, what you can provide him with some alternative initially to begin with. Suppose he's not interested in very much, you can provide him with some alternative thing so that his pattern behavior is gets slightly less, and then gradually you introduce what the things you want to do it, so that his pattern behavior gradually and gradually wean off. But you have to be strict with the rules. There should not be any leniency. Okay, aaj kar lo, kal mat karna. So then he will again develop that behavior, pattern behavior. Gluten free and dairy should provide to child, and please suggest on diet plan. My child is 4 years old. See, again I have discussed this, that gluten CF and GFCF diet, that is gluten free and casein free diet. It is definitely, it is in autistic children, but then it depends upon in which child it is useful. We cannot recommend GFCF diet to every child. It depends upon the food intolerance levels. It depends upon the level of intolerance the child is having, and then accordingly we have to look into the thing, what is the level of tolerance. Suppose if a child is having wheat intolerance and another child may not be having he's having a wheat intolerance of level of 40, a child is having a wheat intolerance of level of say 50. So that accordingly we have to decide how much amount of wheat has to be given to the child, how much not. And all children do not benefit for GFCF. It depends upon, first, the most important thing, unless and until they don't have a documented intolerance, we don't have to go for a GFCF diet, because by limiting the diet, we are also limiting their nutrition, we are limiting their growth, we are limiting their development. So this is very, very important, that we just don't have to run for GFCF diet because every child is going. It depends from child to child. But if you are going for a gluten-free diet, what you can give, amaranth, you can give this amaranth, you can give besan, you can give jowar, bajra, ragi. And for casein free diet, if you are going, you can go for A2 cow milk, you can give coconut milk, you can give almond milk, or you can give what you call soya milk. So these are some of the options. And suppose you can also give ghee, it is casein free, and even you can give curd. Now curd, it is contains casein, but vegan curd is there. Vegan curd means the curd which is prepared from coconut. But again, this is a general advice I have given. Just don't jump and start going for the dairy free products which I have told, like coconut, almond. Why I'm telling? Because sometimes around 30 to 40% of the children, in my experience, I have seen they are having intolerance to coconut, almonds also. So as a result, if you are just jumping on from this advice that if the for dairy free, casein free, I can go for almond and casein, and you may find that you are continuing with the diet and still the problem is there. The child is having intolerance, is having constipation, diarrhea, bloating issues, and suddenly your doctor advised go for intolerance test, and you may find that the levels of almond and coconut are very, very high. So probably that was the reason that the child is not able to tolerate that casein free diet also. So that is why I always advise to go for a food intolerance test, because that is the rational. We have a documented evidence, and then accordingly we can decide what things we can give, what we cannot avoid, and how on rotation basis how we can introduce the diet again. Plus, important thing, we have to also look into his development, we have to look into his nutrition levels, we have to look into his diet, we have to look into his calcium levels. So in total, the diet has to be followed in guidance with with a pediatrician who is having a good knowledge of autism, or a neurodevelopmental pediatrician with good knowledge of autism, or a nutritionist who is having a good knowledge of autism. So these are the basic things which we should always go before jumping directly on an GFCF diet. Yes, giving probiotics is a very good idea. Definitely, probiotics do help in solving gut issues. See, if you Mr. Ashish, if you want to know more about the gut issues, we have presented a webinar on connection between gut issues and autistic brain. And I have presented this webinar. And if you want, we have presented it some time back. If you wanted, you can drop us an email on ID and we can share you the link. It was a paid webinar. Plus, from with every webinar, we also provide the reading material to the parents. It is in the form of PDF. So those who are interested, they can get. But for your question, advice is that yes, probiotics are very, very good. But another thing is that some parents, they follow Nemicheck protocol. See, Nemicheck protocol uses inulin. Inulin is basically a prebiotic. Another problem with inulin is that there is no proper dose of inulin to what age and in what amount it has to be given. So this is how that is why I don't prefer to give with inulin, which is a prebiotic, because it also feeds the bad bacteria. Probiotics, they are live bacteria, they will only promote the good bacteria. For gut issues, how you can see, you will be having bloating issues, you may be having diarrhea, you may be having constipation. The child may not be able to pass stools. There may be a lot of bloating issues. There may be nausea, frequent stomach aches. There may be worm infestations. So these are the ways where you can. These are some of the indications where how you can know that the child is having gut issues. Sometimes the child may be having fungal issues along with the gut issues. Now, how you can to know? Even if you are on a GFCF diet, in spite of that, the child continue to have these, humming, excessive crying, excessive laughing, and even worsening of the gut issues. In that case, you have to think that the child may be having fungal issues. So this is the importance of these yeast overgrowth issues, or you can say gut issues. So this food intolerance panel test, which I advise to my parents, this gives you a screening about these gut issues and also gives you a screening about the yeast overgrowth issues. If we get that the screening is positive with yeast overgrowth issues, then we go for a culture for the yeast. If the culture is positive, then accordingly you have to provide them with this antifungals for some period of time. So giving probiotics is good, but not prebiotics. How to stop mobile addiction? Even I don't know. I'll also, if any one of you exactly knows how to stop it, because everybody is now more it is. First of all, I would say uh, we ourselves should stop the addiction from the mobile. If we are able to stop the addiction from the mobile, our children will stop addiction. This is the true fact of everybody of us, because we are so much addicted with the mobile that in the morning we go for the WhatsApp, and in the night before going for sleeping we always check out Facebook and WhatsApp. So it is the addiction of our, and if we are able to resolve it, the child will be resolving. So that was just but the best thing what we can do about mobile addiction, see, there is a standard guidelines which are given by WHO, World Health Organization, that a child before 2 years should not go for a video screening of more than 2 hours. Maximum of 2 hours for a child less than 2 years, and less than 1 year should not more than 1 hour in a day, in a 24 hours day. So the best thing, you have to involve him in a lot of activities, involve him in a constructive play, and whenever you are there at the home, just keep your mobiles in the switch off mode, or obviously it is not possible, keep them in a silent mode. Try to have food together on the dining table during the during the meal times. Try to take meals together or with all the family members. Avoid using mobiles during the meal times. And also it's not, and also strictly you make a timetable that okay, this much time you will be allotted for the mobile, and stick to that. Rest of the time involve the child in major activities. Even if it is not involved in the activities, just don't the mobile should not be visible in front of the child, even if it is yours, even if your wife's or any other. It should be kept in some other place which is away from the child's reach, and it should not be visible for the child. But definitely you have to give some time, allotted time to the child where he can use, but that should be, and it should be a rule. There should not be ifs and buts, there should not be leniency in that. So this is how we can gradually basically wean off his addiction from the mobile. So we have answered most of the queries. So now we'll be are there any queries from any of the parents? Otherwise it's time also, and we'll be closing up the session then. And I'm writing the email ID. If those parents who are interested in any further queries, if they require, we'll be taking up in the next session. And probably we'll be taking another session, probably say next week. And that will be basically updated on our YouTube channel. And for any problem or any webinar links, if you want further discussion on that, or any links you want to take, you can drop us an email at Giggles Clinic. I'm writing the email ID. gigglesclinics@gmail.com. So you can, any of the parents who is interested. So I'll be taking up this last query now. My child sometimes wait for too much time, even ask permission to drink water, take any toy to play for. He wasn't like that before. I feel he stopped thinking and used to instructions. See, it could be a reason. If firstly it depends upon are you, it could not be on the instruction, it could be more of prompts. He probably, I would say, I think your point of view is that the child is more on prompts. So initially I have told discrete trial sequence. Initially when you give the commands, when you try to instruct the child, we always make the child on prompts. But what happens, gradually and gradually you have to wean off from the prompts. We don't have to. Our aim is the child should become generalized, means to say he should not be specific. He should not be performing an instruction only on specific ideas, only on specific commands. So what happens, try to wean off your prompts. I think the child is more on prompts, so you have to try to wean off your prompts. Either it may be a verbal prompt, it may be a physical prompt, either by pointing, or it may be a verbal prompt. So if you think the vocabulary of the child is that much, or if you think the child is following instructions, using your eye contact, knowing the things what to collect, you gradually and gradually remove the prompts. Because unless and until we will not remove the prompts, the child will not initiate to talk. And this was the thing which was there with my child also. He was very much dependent on the prompts initially. So we gradually and gradually wean off the prompts. And his physical, he was more on verbal prompts, so we gradually wean off the prompts, and that made him initiate. So initially we have to look whether the child is speaking, he has the vocabulary, he has the sounds. If he has and he speaks words, then you gradually wean off the prompts and initially motivate him to speak. Unless and until we don't motivate him, the child will be dependent upon the prompts. He will know, yes, mother will tell and I will get it. So wean off the prompts. This will initiate the child's speech and language. Homeopathic medicine effective in autism? See, it's frankly speaking, I don't know, because I'm not a homeopathic expert, and I think a homeopathic doctor can answer you best. But from my point of view, I don't think any medicine, whether it is homeopathic or allopathic, is directly effective. It depends upon the person to person, depends upon the severity, and also depends upon what other factors we are involved in. So homeopathic doctor will be able to answer this question better. So thank you, parents. I hope it was a good interactive session. Be able to learn a lot of things from each other, and hope to see you again in the next upcoming session. Whenever we plan, we'll be updated on our YouTube channel. And any parents who are having any queries, and if you're interested in taking any webinar links or any PDF material, they can just drop us an email and we can revert back to you. Thank you. Thank you, parents. Take care. Good night.